Hi, everyone. Welcome back to Heart Health with Michelle. Today, I have a liver expert, a chief medical officer and director of the Fatty Liver Program at Arizona Liver Health, Dr. Naeem Alkhouri. And I'm so excited to have him on this channel today because we're going to talk about fatty liver disease. We're going to really dive into what you need to know and understand the significance and empower you to ask more about it, but also to take more of a proactive approach because it can be reversed and it's very linked with cardiovascular disease. Before we get into those nitty gritties, I love to welcome Dr. Naeem Alkhouri and also have him share a little bit about himself with you as well.
Thank you so much, Michelle, for having me, and congratulations on the launch of your YouTube channel. And also thank you for raising awareness about non-alcoholic fatty liver disease, definitely an underdiagnosed illness. So I work at Arizona Liver Health. We have 3 offices in Arizona where we treat all chronic liver diseases with the focus on fatty liver disease. We also participate in clinical trials, and we are working actively on developing new drugs to hopefully help with lifestyle intervention to mitigate the risk of fatty liver disease.
I love it. Thank you so much for being here. So let's talk before we even go into how do we know we have fatty liver disease. I find that, and one of the reasons why I love doing this YouTube channel and talking with so many important and knowledgeable physicians is the connection. So we know cardiovascular disease is the #1 killer globally, and it shouldn't be. 80 to 90% of it is reversible with nutrition and lifestyle intervention. And being in my private practice and seeing so many of these individuals, I find that a lot of times it's the unawareness, it's the conversations that don't happen that need to happen. And that's one of the reasons why I created my YouTube channel, to make people aware, empower them, and take ownership of their health. So I want to connect and really explain to people the significance and the connection between fatty liver disease and cardiovascular disease. I want to explain what is going on that we don't necessarily see that's causing fatty liver disease to be an independent risk factor for heart disease, heart attacks, and strokes. So if you could talk a little bit more about that, I think that would be a great introduction to our conversation.
Yeah, absolutely. I mean, I think there are many similarities between non-alcoholic fatty liver disease, NAFLD, and cardiovascular disease. Both of them are typically silent in the initial stages. You can have dyslipidemia for years and years, and you will not know unless you go get tested. I think, for dyslipidemia, we have national guidelines and we have a very clear pathway what you need to do. But for NAFLD, we are just in the initial stages now to have screening guidelines for high-risk individuals. So fatty liver disease, just by definition, is really the accumulation of fat inside the liver cells. And if you have more than 5% fat, we call it fatty liver. The first thing we ask about is alcohol consumption. So you want to make sure that this fat accumulation is not caused by alcohol. And then if you have risk factors for fatty liver disease like obesity, hypertension, dyslipidemia, what we call metabolic syndrome, and of course type 2 diabetes, and you don't drink excessive amounts of alcohol, we call it non-alcoholic fatty liver disease. So as I mentioned, the risk factors for NAFLD and cardiovascular disease are very similar, right? Obesity, hypertension, dyslipidemia. Fatty liver disease is very interconnected with insulin resistance. And this is obviously a major driver of type 2 diabetes and cardiovascular disease. NAFLD is asymptomatic in the majority of patients. So when I see patients coming to my clinic, I say, do you have any symptoms, any abdominal pain? And most of them say, no, I feel fine. And that's why we need to be proactive and screen for it the same way we screen for, cholesterol numbers and identify high-risk patients and initially implement a lifestyle intervention. So that's the first similarity. We've had several studies now show that having fatty liver by itself is an independent risk factor of cardiovascular disease. So, regardless of the dyslipidemia and the prediabetes, diabetes, some people can have diabetes but no fatty liver disease and vice versa. But having fat in the liver by itself is a predictor of cardiovascular disease. So in my mind, anyone with type 2 diabetes, anyone with coronary artery disease, anyone with metabolic syndrome should be asking their primary care physician, cardiologist, endocrinologist, that, hey, I hear I'm at risk for fatty liver disease. Have you looked for it? And should I go actually see someone who can do an easy test to tell me if I have fatty liver disease or not? And this is part of the new guidelines now by the American Gastroenterology Association, by the American Association for Clinical Endocrinology, to actually proactively screen for fatty liver disease in at-risk individuals.
I think that's great. And one of the things I really want to point out, because I find this a lot, is many people will say to me, I'm not overweight, I'm not obese, so how can I have fatty liver disease? And I think it's important to also mention that you can be a normal weight and still have fat accumulation around your liver. Insulin resistance can still be present in someone who isn't overweight. And insulin resistance and inflammation and oxidative stress are the three things that cause promotion of plaque in the arteries and also are present when somebody has fatty liver disease. And I also think it's important to note that fatty liver disease is reversible. And the earlier we know about it, the more we can intervene and have good results. And that's really important. So these questions that you're asking, don't just expect that your physician is looking into them. It's important that you also inquire about it. So if someone says, okay, you know what, I think I'm insulin resistant, I have high triglyceride levels, for instance, or I have a lot of excess skin tags, or my blood sugar is creeping up, or I have stubborn weight loss, or I have an increased waist circumference, I know I'm insulin resistant, for instance, that might be a point of, okay, let's check in for fatty liver disease. But how do we know? And can you talk a little bit about our liver enzymes? Do our liver enzymes increase if we have fatty liver disease? Could we have normal liver enzymes and still have fatty liver disease? Because a lot of times it's based off of one prognosis and it might not necessarily be accurate. So I'd love to hear more about that too.
You're absolutely right. So liver enzymes usually, they're within the liver cells. When the liver cells are sicker than normal because of fat accumulation, they start dying at a higher rate and they release the enzymes into the blood. So this is how we can detect that there's potentially some liver damage. So this could be the first sign of fatty liver disease. This is probably the most common way I get patients coming to my clinic. Their primary care physician or diabetes specialist decided to do liver enzymes and they see that they're elevated and then they send them to see me. But we have studies now showing that, for example, in patients with type 2 diabetes that have normal liver enzymes, we call them ALT and AST. So patients with diabetes, normal ALT levels, if you do an MRI of the liver to quantify liver fat, 50% of these individuals have fatty liver disease. So that's very important to know that you can have normal ALT and still have fatty liver disease. I think liver enzymes also, historically speaking, we set them at a high level. So many labs use a value of 45 or 50 as the upper limit of normal. But what we learned recently is that it should be around 30. So this is, one opportunity that is missed frequently. If the lab is not highlighting the liver enzymes for the primary care physician, they think they're normal. But when you look at the value, the ALT is at 42 or 43, which is high for a healthy individual without fatty liver disease. So thank you for bringing this point. So the next question is, well, if my liver enzymes are normal, how do I find out if I have fatty liver disease? We used to use ultrasound, which is, a good screening test, but has limited accuracy in specific circumstances. So what I use in my clinic is a machine, we call it the FibroScan machine. This is an ultrasound-based technology, but actually it gives you numbers for how much fat you have in the liver. That number is called the CAP score or CAP. I tell my patients this is your fat number, but also it gives you a number that measures liver stiffness, and this is a way to assess how much damage and scar tissue or fibrosis you have in the liver. So you get another number called the liver stiffness measurement. So you do one test that takes about 5 minutes, and then you can diagnose fatty liver disease and determine its severity and its likelihood of progression. So very simple test. It's not the only test out there. There are several, other imaging tests that you can do, and there are some also blood biomarkers that can tell you about the severity of fatty liver disease, but this is probably the simplest one where you can screen and determine severity in one test. And the results will be available in real time. So you can sit down with the patient and share the report and explain what the numbers mean.
I love that. A lot of people come to me and say that their fatty liver disease was found on an ultrasound by mistake. They were doing an ultrasound to assess something else and they found, oh, wow, you have fatty liver disease, but there's no percentage of fat. There's no, indication. It might even say, they have an enlarged liver, but other than that, it doesn't really tell them the percentage. So would you recommend that they do a follow-up to assess the degree to get a FibroScan? Do you have to go to a specialist to get access to a FibroScan?
Thank you so much for bringing up this point. Very important. So the main message, from this interview that I want to put out there, that if you are told you have fatty liver disease, today it's not okay to just be told, well, you need to lose weight and you're going to be okay. You need to find out how bad is it, okay? And when we say how bad is it, it means this fibrosis stage or how much scar tissue you have, okay? Because, fatty liver disease really is a spectrum. And if you just have fat and no scar tissue, probably you're going to be fine in the near future. And, this is completely reversible. But if you have fatty liver disease and advanced fibrosis, then you become at risk of progression to liver cirrhosis, which, by the way, can happen without drinking any alcohol. So this is another big misconception we deal with. So you can actually develop cirrhosis from diabetes. This is important to know. So again, if you have advanced disease, you become at risk of progression to cirrhosis. Once you have cirrhosis, you become at risk for liver cancer as well, and then potentially developing end-stage liver disease, or what we call decompensation of liver disease, where liver transplant is probably the only cure. So I think you need to know where you're at on that spectrum. When we talk about fibrosis, we have 4 stages, and stage 4 is cirrhosis. So if you do the scan and you're told you have stage 3, that's very concerning, as opposed to doing the FibroScan and being told you have fat, but there's no fibrosis. So I think, knowing the severity of the disease is important, and asking that follow-up question to your primary care physician. If you're told you have fatty liver disease, you should say, well, how bad is it? Where am I on the spectrum? What are my chances of actually developing liver cirrhosis? And the FibroScan is a good initial step. It is available now, and it's becoming more and more available in subspecialty clinics. But there are other tests that can be done. And the simplest test that anyone can do, primary care endocrine, is something called the FIB4 index, FIB4. And this is basically a simple calculation that uses liver enzymes, AST and ALT, and the platelet count. These are the clotting cells, and then age. And we put them in a simple equation, and you get a number. It's very good to tell you don't have advanced disease. So this is what we call ruling out advanced disease. It's not very accurate to tell you for sure that you have advanced disease, so you need to do another test, but that's the easiest thing you can do. There are serologic tests also that your primary care doctor can order. They're available through commercial labs, including something called FibroTest and another test called the Enhanced Liver Fibrosis Test, or ELF. So again, once you're diagnosed with fatty liver disease, there's a next step, which is determining the severity. And this can be done with imaging or blood tests or some simple calculations. So we have many options. There is absolutely no reason to just be told you have fatty liver disease, but we don't know how bad it is. We can actually tell you exactly how bad it is with the new technologies we have.
Right. And it also allows you to intervene when you can intervene, right? A lot of times when we just watch and see, it can advance, and then you're kind of in that place where there's not that much intervention like you spoke about. And that's really important to know. So we're not saying, okay, it's not to scare you, it's to empower you, because the more information you know, the more you can actually do something and take action. So we're going to get in our second episode about all the ways we can reverse or manage fatty liver disease, depending on the stage it's in. So stay tuned in episode 2 for that. But I want to ask, so someone is doing lifestyle intervention, maybe they're doing medication management also with fatty liver disease. When is it appropriate to recheck it? Should they do another FibroScan follow-up to assess? What's a good time frame to know, okay, you know what? I'm working on improving this. How do I know the time frame for progress?
Yeah, I mean, that's very important, right? If you implement an intervention, you want to see if it's working and do you need to add something else to it. So I would say at 6 months, that would be a good time to repeat the FibroScan, and you expect to see improvement in that CAP score or the FAT score. Usually the liver stiffness or the fibrosis stage will lag behind a little bit, so it may take a year or two even before you see significant improvement, but definitely in terms of reducing the amount of liver fat, that can happen pretty quickly. So 6 months would be a good time. And same thing with liver enzymes. So if you're actually implementing an intervention that's working, you expect your liver enzymes to come down. That ALT number should go down. Even when you start sometimes in a range that's close to normal, actually, once you lose weight, you see it go further down. So I think monitoring the ALT and AST liver enzymes, monitoring the fat number on FibroScan and the liver stiffness will be the easiest way to assess for response.
Excellent. I know this is kind of late in the question game, but I think some individuals might be wondering, what does my liver even do? And when there's fat accumulation and it's stiff, what does that mean as a physiological process? What happens? And I think that can really help understand, because when we talk medically, we understand all these the back end of it. But I think as someone who's not in the science field, it's always nice to kind of dive a little bit further so that they're understanding why this is so important and what this vital organ does in our body.
Yeah, so I'm biased here, but I think the liver is the most interesting organ in our body, and it has really so many functions, about 500 different functions. The liver is really where you package all the nutrients. Everything we eat has to go through the liver through a vein we call the portal vein, and then the liver actually gets the energy out of the food and distributes the energy to the rest of your body. So it's really the engine for your body. And that's why when patients have advanced liver disease, their main complaint is fatigue. They feel tired all the time because, again, your engine is not working properly. The liver is also very important to detoxify our body from many of the toxins that we eat or they are produced by the gut microbiota. So it's also the filter for the body. And then it produces many important proteins, including clotting factors. And that's why when patients have advanced liver disease, they have easy bruising, they have bleeding. This is an important function. It also produces bile acids, and bile acids are very important to absorb fat and fat-soluble vitamins. If you have, certain liver diseases, you become deficient in vitamin D, vitamin E. So, we're routinely checking for these. What happens when you have fatty liver over time? The liver cells are dying. The liver tries to repair the damage by producing scar tissue. This is what we call fibrosis. But if you're making scar tissue every day because you have fatty liver disease, that becomes actually harmful, and you end up with liver cirrhosis. When you have cirrhosis, that blood flow through the liver is affected, and you start having higher resistance inside the liver, and that actually leads to fluid spilling into the abdomen. So fluid accumulation in the abdomen is a sign of advanced liver disease. We call it ascites. The liver starts losing its function, so you're not producing the clotting factor, so you become at risk of bleeding. Some people turn yellow, jaundice, and some people get confused also because the liver is not detoxifying all the toxins. Having advanced liver disease is typically a devastating illness that has a big impact on quality of life of the patient and their loved ones, because they become tired, they become confused, they sometimes need to go have a needle placed in the abdomen to drain the fluid. So it's a big deal, and for me, it's something I never want to see in my patients with fatty liver disease, that they progress to cirrhosis and all these complications.
Yeah, no, I think that's so important. And I think that helps to give light that most people think alcohol is the only thing that can, damage the liver, but we know what we're eating and our lifestyle choices and so many things can impact our liver function, because our liver has so many functions, and that's really important. And I always say that, your heart is obviously the most vital organ. Without your heart, you can't, none of your organs will work. But it's all connected, and we need to make sure that we are making sure all of our organs are protected when we're looking at the full story. My last question before we go into management and, reversal of fatty liver disease is, can you take a second to explain the progress? So, you have fatty liver disease and maybe it's only 5% fat. How does it progress, or what does it look like as we go from fatty liver disease to advanced cirrhosis? I mean, there is steps in between, and I think it's important to mention that right before we go into the management and treatment protocols.
Yeah, absolutely. I think that's a very important question. So we start with the fatty liver, as you said, just fat inside the liver cells. Sometimes we call it simple steatosis. Steatosis means fat, or just non-alcoholic fatty liver. But then you can progress to having, on top of fat, liver inflammation, accumulation of immune cells inside the liver. And then you can also have what we call liver cell injury. Sometimes we call it ballooning. These liver cells become swollen like balloons, and that tells you that they're sick, they're about to die. So if you have fatty liver plus inflammation plus ballooning or liver cell injury, this is what we call NASH, non-alcoholic steatohepatitis. So steato means fat, hepatitis means liver inflammation. And I want to clarify here that this is not caused by a virus. This is just, from fatty liver. So every time I use the word hepatitis, my patients say, oh, so I have a virus. I'm like, no, hepatitis means liver inflammation. So NASH is what we call the aggressive form of fatty liver disease. And once you have NASH, you start developing that scar tissue fibrosis. So you go from, again, fatty liver to NASH, from NASH to fibrotic NASH. This is when you have that scar tissue depositing in the liver, and then that has 4 stages. So stage 1 is very mild, 2 is moderate, 3 is severe, and then stage 4 is cirrhosis. And then the last stage is what we call NASH cirrhosis. And once you have NASH cirrhosis, you become at risk of what we call hepatocellular carcinoma, or liver cancer, basically.
Gotcha. Okay. That's so, so important. So it's a progression. It's not that you start off with NASH, it's really a progression. And so inquiring about if you're at risk for fatty liver disease, catching it early can help prevent that promotion. And we're going to talk about that the next episode. But I really wanted to just use this time to explain, and you did it so beautifully. So I really, really appreciate it. Talking about knowing that fatty liver disease is something we need to be concerned about, and we need to understand, are you at risk? Get diagnosed if you are, understand the severity of it, and then we need to intervene and see a specialist who can really help. So thank you so much for this. I want everyone to meet us in part 2, where we'll talk about the management and treatment options for fatty liver disease. Any last words that you'd like to share with us, Dr. Alkhouri?
Again, thank you so much for doing this segment with me. And I think, this is very important, just making the connection between heart health and liver health, and also explaining to our patients the importance of determining the severity of fatty liver disease and seeking expert opinion in terms of management. So thank you again.
Yeah, thank you so much. We'll talk soon. Stay tuned.